Hello, this is Mike McClernand. I'm the owner of Assisted Living Locators on Long Island. My business is helping seniors and families find the right assisted living or memory care community. Today we have a special presentation, a discussion about memory care. I have a guest, Julie Wexler. Julie, would you introduce yourself, please?
Thank you so much for having me here today, Michael. I am Julie Wexler. I'm the Director of Business Development for the Bristol Assisted Living.
Thank you, Julie. So we hear the topic memory care, dementia care. We hear the term dementia care, memory care all the time. I think most people are familiar with assisted living. When seniors need some help with the activities, the physical activities of daily living, they find an assisted living community. There's a parallel for people who have cognitive problems. Julie, you've worked in this area for a number of years. Would you explain to everyone just what a memory care community is all about?
Sure. So within each one of our Bristol communities, we have a community within the community, if you will, that we call Reflections. And it is a smaller, more structured, more supportive environment compared to our regular assisted living, if you will. So you can expect in a Reflections neighborhood to one for it to be smaller, right? More manageable for the individual with memory loss. You can also expect there to be a dedicated team of professionals who are specifically trained in dementia care, communication skills, behavior management, and everything that we do in Reflections is really designed to support the person with memory loss, from the way that we serve the meal, the way that we communicate with the resident, the way that we provide assistance with activities of daily living. Everything is designed to make them feel safe, to make them feel like they have value and worth, and ultimately to provide safe, loving, and supportive care for individuals, whether they are in the early stages of memory decline or even on through to the later stages.
Thank you, Julie. Julie, not every senior with a bit of a memory problem needs memory care. What are the conditions, the underlying conditions that would probably put a person into memory care as opposed to assisted living?
That's such a great question. And it's a question that we are asked often when families are considering moving their loved one into a Bristol. And you're exactly right. Just because a person has a diagnosis of Alzheimer's or a diagnosis of memory loss doesn't necessarily mean that Reflections is going to be an appropriate placement for them. We do a very thorough evaluation, an assessment that's done by our nurse or our case manager to determine where the best fit would be. And we certainly do have people with memory loss in our assisted living. And they do very well. They benefit from the structure, from the 3 meals a day, from the social interaction, the social stimulation, having people around. It sort of recreates life for them, especially if they become more isolated. And they do very well. And as long as they're sort of self-initiating, if you will, they're able to go to activities, and the activities that we're running on the assisted living side are appropriate for them, then assisted living could be a really great fit for somebody even with mild memory impairment. The other thing that we look for too is that they're able to feel like they have dignity, right? So we have, in our dining room, we have a very nice menu, and is the person able to read the menu and be able to make a selection, right? So these are some of the things that we look for when we're making the determination of whether or not the assisted living side is appropriate or if they need the secured memory neighborhood. So if they are a wander risk, there's no question, right? They need to be in Reflections because that is a secured area. On the assisted living side, that door is open. They want to go for a walk, the front desk can try to redirect them. But if they are a wander risk, then absolutely Reflections is going to be the best fit for them. If they need more attention, more prompting, more guidance, more one-on-one assistance, then Reflections might really be the level of care that's appropriate for them. People might think that it's them losing their independence, but actually, if they're in an environment that is designed for them, where the staff are trained properly, where the activities are appropriate, where we're giving them the same selection, but easier choices to make, right? Instead of giving them a menu, do you want the chicken or do you want the steak? just easier ways of making decisions so that they still do feel independent, right? We're sort of simplifying life for them so that they can have the best quality of life under the circumstances.
Oh, thank you, Julie. The disease states that lead someone into perhaps memory care, we all heard about Alzheimer's. What other kinds of diseases that affect the brain would make people probably a better fit for memory care?
Well, we know that there are many types of dementia, right? And dementia is, is a group of symptoms. It's not only the memory impairment, but the cognitive decline, but it also might be a decline in the ability of a person to communicate or to perform activities of daily living, like dressing themselves. So we don't necessarily look at the disease or the diagnosis. What we're really looking at when a person is moving into our community and we're making the decision of whether or not they need to go into reflections or if they're going to be appropriate for assisted living is really how well they're functioning. So, dementia is sort of this umbrella term, and then there are different diseases that cause dementia. Could be Alzheimer's, could be vascular dementia, Lewy body dementia. To us, the diagnosis really isn't as important as it is how is the person functioning.
Thank you. My own mother had Parkinson's, and when her dementia just became too much for us to handle at home, we found a nice memory care community, and she did better than she was doing at home. It was better for her. Julie, one last question. What is it physically like in a memory care community? Do people have apartments? Do they have open rooms? Just describe the physical environment a bit, please.
That's such a great question. So, in memory care, even the physical space is designed to provide a sense of safety and independence. So at a Bristol, everyone has their own private apartment. Typically in reflections, it's going to be a smaller apartment. It's either going to be a studio apartment or it's going to be what we call a friendship suite, where they'll have their own private bedroom, private bathroom, but maybe a small shared kitchen area. I want to remind people that when you move into an assisted living, particularly into reflections, into memory care, that the space really becomes kind of secondary to all the other services that we are providing for you. What you really want to look for, and yes, the space, it should be bright, it should be clean, it should smell good, it should be, there should be spaces for people to be able to congregate and spaces for people to walk. There should be outdoor space. But we want to just make sure, more importantly, that they're getting care by trained, loving, and supervised staff who you really have to love what you do when you work in memory care. And that's really the most important thing.
Julie, this has been very helpful. Thank you very much.
It was my pleasure. Have a great day.
Bye-bye.